Okay. In this video, we'll talk about neurotransmitters and associated neurological disorders. Most commonly used drugs treat such conditions and the role these drugs play. They act as agents or antagonists. Now, if you look at this table, the first column is about neurotransmitters. So the first one is GABA, Nor-epinephrine, Serotonin. The second column is the disorder associated with the specific neurotransmitter. The third one is the commonly used chemical drug for that particular condition. And the last one is the way the chemical acts on the nervous system. You'll also notice in the neurotransmitter column that there is a negative sign here. And in the next slide or so, you'll see positive sign. These signs indicate the abundance or lack of specific neurotransmitters. A negative sign means that particular neurotransmitters, if it is deficient or unavailable, it is associated with a specific disorder. Okay, I hope the organization of the table makes sense. Let's move on. This GABA neurotransmitter, decreased amount or decreased availability of this particular neurotransmitter leads to anxiety. And the common chemical that's used is the anti-anxiety medicine such as Valium. And the way Valium works is it acts as a GABA agonist. Remember, anxiety is because of lack of sufficient GABA. And what is this chemical doing is it's acting as an agonist, meaning it will increase the availability of GABA. There are different ways agonists act. The main function of an agonist is to increase the availability of specific neurotransmitters. They can either act as neurotransmitters themselves, or they can somehow increase specific neurotransmitters presence in synaptic cleft. We'll talk about one such example here in a second. If you look at the second neurotransmitter, Nor-epinephrine, the decreased amount of it is often associated with depressive symptoms. There are several antidepressants that are used in this situation where these antidepressants act as norepinephrine agonists. You'll also see depression associated with decreased amount of serotonin. In that situation, we use serotonin agonists to increase the availability of serotonin in the individual's nervous system. In this case, a specific antidepressant called SSRI are used. SSRI stands for selective serotonin reuptake inhibitor. If you remember, only two neurotransmitters in given synaptic cleft get attached to the receptors on the postsynaptic neuron. And we said there are several things that may happen to the remaining neurotransmitters. They either get degenerated, or they get deactivated, or they are just move away. Or one of the things we discussed was the presynaptic neuron can reuptake or reabsorb these and recycle and send them back. What this antidepressant SSRI does is it inhibits the presynaptic neuron to reuptake the serotonin back, so that is more of serotonin in the synaptic cleft, resulting in more availability of serotonin and thereby influencing positively, thereby treating this condition temporarily. It's called selective serotonin reuptake inhibitor because it is inhibiting the reuptake or reabsorption of serotonin from the synapses. In this table, you'll see the same format neurotransmitters. It's positive or negative sign, the disorder associated with the chemical often used in this condition and the way it works. So here, dopamine, excess of dopamine results in schizophrenia, and often antipsychotic drugs are used. And to treat this condition, these antipsychotic drugs act as antagonists. Excess of dopamine in certain parts will lead to schizophrenic typical symptoms, including hallucinations and delusions. So what antipsychotic drug does is it blocks the dopamine receptors in the synapses of the postsynaptic neuron, thereby making dopamine less available and thereby decreasing those symptoms. The opposite of this is decreased amount of dopamine, which results in Parkinson's disease. There is irregular movements of different muscles and fine motor movements are lost in this individual. And Yeah, and the reason why we don't have chemical action here is that in most of the cases, the reason why you see Parkinson's condition is not because there is dopamine and is not available readily, but because the cells that produce dopamine in specific parts of the brain, they are dead, not making enough dopamine. So, and there are other treatment measures, so that's why these um, open. Acetylcholine is another neurotransmitter, and lack of it are associated with Alzheimer's disease. One last thing, just to give you some information about the specific actions of some important neurotransmitters that naturally occur in our body. For example, dopamine, we have seen increase or decrease amounts of dopamine in the system and lead to several disorders. But dopamine itself, naturally, its role here is several things, including giving a feeling of pleasure. Chemical equivalent act as dopamine agonists include such chemicals as amphetamine, cocaine, opiates, alcohol. All these things mimic the action of dopamine, thereby acting as agonists. And no wonder people get hooked onto this. But here's the good news. There's another thing that actually gives a similar feeling of euphoria. Uh, Love. Glutamate is a neurotransmitter. It increases the activity in general of the nervous system. The caffeine is an example for a chemical that mimics glutamate and increases the level of activity. That's why people take caffeine to be active. It acts as stimulant. The last one is endorphins. These are called endorphins because these are endogenously available morphines in our body. These are the morphines that naturally our body produces. Endorphins act as painkillers, give a euphoric feeling of pleasure, and a general sense of well-being. And these endorphins are usually increased in our body when you do strenuous exercise. The feelings of pleasure and well-being after a long run are because of these endorphins. Now, chemical equivalents of these endorphins include morphine, heroin, and narcotics. These chemicals act as endorphin agonists because they mimic the action of endorphins and give a similar feeling. You can there are other ways to get these feelings. You don't need to go like this. That's it in this video. And in the next video, we'll talk about several other things, including the nervous system. Before we get to another video, try to answer this question. What is an afferent? What is an efferent? And we'll talk about